Hey guys, what's up? It's Stephanie. Welcome back to my channel. So in the video today, I'm going to be discussing how you can prepare yourself for a physician assistant or even advanced practice provider, which includes both nurse practitioners and PAs, for an interview for residency/fellowship, whether it's in emergency medicine or critical care medicine. How can you prepare yourself for this interview process? I've gotten a lot of messages through my Instagram in regards to what advice can I provide to them, and I decided to make a video since I've had multiple, and I think this is going to be the best way I can address this. So just a little bit about me. I am currently a physician assistant resident who is completing a residency/fellowship in critical care medicine. It's a year-long residency/fellowship. I do 13 months in critical care medicine specialties, which include surgical trauma ICU, surgical ICU, neurotrauma ICU, neurovascular ICU. Also, it's going to be rapid response team, cardiothoracic ICU, transplant ICU, and then on top of that, I also do have rotations that are going to be elective, in which I'm able to pursue anything I want to do. So, for example, if I'm interested in neurovascular ICU / neurotrauma, which I am interested in, I can do a rotation with neurosurgery, so I can familiarize myself with the type of surgeries that they do, since a lot of these patients we're going to be taking care of. My fellow co-resident that's with me, she's interested in surgical trauma ICU, so she's going to be doing some rotations at the surgical trauma bay, which is awesome. We can also do a rotation with radiology, so we can familiarize ourselves with reading scans, CT scans, MRIs, etc. So that's basically what our residency/fellowship is. We work about 6 days a week. Sometimes shifts tend to be between 10 hours to even 24 hours. So usually we'll complete a 24-hour shift during the week. And yes, that's from 6 a.m. till 6 a.m. the next day. Sometimes you get to sleep, but the majority of the time you don't, which has been the case for me because it's been very, very busy. And we usually get 1 week off. We get resident pay. So of course it's salary based. So no matter how many hours you work, there's been weeks where I work about 70 hours, even more, you still get paid what you get paid, which is fixed base. And I do have to say it's not as much as you would get paid as a full-blown physician assistant. You work alongside other residents, and those are residents that have completed medical school. So you'll work along physicians, physician fellows also, and usually residents, you work from different specialties. I've worked with orthopedic residents, ENT residents, dental anesthesiology residents, etc. So we all work together, and the attendees do a really good job because they don't single you out. They all treat you the same. So I really like this about this fellowship/residency. So what can you expect from the interview? So I interviewed during the COVID-19 pandemic, and most of the interviews that I did and complete were through FaceTime like this. Or through Teams is what they call. And for this specific fellowship, they only accepted 2 APP residents, whether it was a physician assistant or a nurse practitioner. In my case, it was 2 physician assistants, so me and then my fellow co-resident who is a physician assistant. And we both had 3 interviews. So I had the first interview with the chairperson of the residency. She's a nurse practitioner. My second interview was with another nurse practitioner who also is involved with the residency. And then my third and final interview was with the medical director of the critical care medicine unit. And so those were the 3 interviews that I did. So the first interviews, questions that you, of course, are they going to expect to ask you, or you just expect to get and prepare yourself for, are going to be questions like, tell me why you want to pursue critical care medicine. Why do you want to do critical care medicine and not emergency medicine or any other type of specialty? And what have you done to further your interest and experience in critical care medicine? They don't ask you that, but that's what they imply when they're asking you why critical care medicine. So make sure that you prepare yourself and answer this question in a way that really pursues and tells them that you really want to pursue critical care medicine and that's what you want to do. And why do you want to do this? What have you done to do this? So for example, in my case, I discussed that I had completed a 3 to 4 month rotation at a burn hospital where we worked alongside with the critical care unit, and I discussed everything I learned from that rotation and how that rotation further spurred my interest in critical care medicine. I also discussed how, for example, I want to do critical care medicine because I really like the critical care thinking that you do, or the critical thinking that you do in critical care medicine, right? You have to make sure that you're thinking about everything. I like how it involves all the body systems. You have to make sure you have really good knowledge in regards to the brain, the pulmonary system, right? The GI, everything. So you have to make sure you put everything together, and that's something I really liked about critical care medicine. Also, all the procedures that you get to complete. You get to learn about bronchoscopies, arterial lines, etc. So that's basically what they want to know, is why critical care medicine and not emergency medicine, and why or what have you done to further pursue your interest in critical care medicine. So I would definitely discuss any specific rotation. If you, for example, complete a rotation in critical care medicine, I would definitely advise you to discuss this during this question. You want to make sure that you pursue that you really, really want critical care medicine, and this is why you apply to this residency. So that's going to be one of the questions that are definitely expect to be asked in regards to why critical care medicine residency. Why critical care medicine? The other question that I was asked is, why do I want to complete a residency? So because as a PA, you can apply to a critical care medicine job. You don't need a residency. But why did you decide to apply to a residency instead of going straight through and applying to a job? And the reason I gave is that I want to make sure that I provide the best care that I can to my patients. And I feel like I'm going to get that through a critical care medicine residency. I want to make sure that I'm well-rounded and I gain as much experience as I can. And I think a critical care medicine residency is going to be able to do that. I'll be able to learn as much as I can, and I'll be able to apply these skills as a future physician assistant once I'm working in critical care medicine. I'm working as a critical care medicine physician assistant. Other questions I was asked was, tell me about a time where you disagreed with one of your fellow supervisors, whether it was an attending you had or whether it was a fellow coworker, and how you handled that situation. So make sure that you think about a time of when you disagreed, you give the reason why you disagreed and how you handled that situation. I remember there was one case that I gave where I disagreed with one of my fellow preceptors in regards to the treatment plan I had for the patient, and just discuss of what you did and how you resolved it, right? Make sure it always ends in a positive note and not a negative note. Other questions that I had was, one that really threw me off was, tell me how your best friend would describe you. So make sure that you prepare yourself and know how to speak about yourself. They also asked me, what are my weaknesses and what are my strengths? Another question that they asked me is, do I plan to stay with them after completing the residency? And that's one of the things, a lot of these residencies and fellowships, is that they want to make sure that the time that they're investing in you is going to help them in the future. So that way they're investing time in you, so they want to make sure you're a good PA and you stay with them. So that was another thing that I discussed during my interviews, is that if they invest all this time with me and they accept me to this fellowship/residency, I will ensure that I stay with them, and I will ensure that I provide the best quality care I can to my patients with all this knowledge and experience that I've gained during this past year. So that's something that they also want to hear. They also want to know about, why did you end up choosing their hospital or their residency versus different residencies. So this, I really recommend that you research the program that you are applying. Research it thoroughly. That's what I did. I spent days going through their website, also looking at how many critical care units do they have, for example. That's one thing that you want to know, like how many critical care units do they have, which ones do they have. That was something that I mentioned during my interview. They were very impressed because I knew a lot about the residency or program. One of the individuals who interviewed me even told me, wow, I didn't even know we did that. So make sure you know a lot about the residency or program that you are applying to. because you're going to be asked, I can guarantee you, a question of why you decided to go with them and not someone else. And the individual who told me that was very surprised with the answers I gave him, he even told me, you and one other person that I've interviewed were the only individuals who have told me about my program offering this, which was something I didn't know. So make sure that you impress them with how much you know. Like I discussed, how many hospitals are there? What is their patient population like, right? Do they serve primarily underserved areas? What is something that's very commonly seen here? Is it a population where you have a lot of diabetic patients, etc.? So familiarize yourself also with the individual that is interviewing you. So if they send you an email, sometimes they'll tell you who you're interviewing with, and I would try to familiarize myself who was interviewing me, so I could, maybe relate with them. So ensure that you research the person that's interviewing you, research the program that you're applying to, and make sure that you know it very, very well. That way you're able to discuss it during this question. So for example, when they asked me why I decided to choose that fellowship or residency, I said, you know what, I decided to choose this because you have multiple critical care units throughout the city of etc. And there's something I really like about this residency. I like the fact that we rotate through each one. I like the fact also that we have elective rotations towards the end, and we're able to choose the rotation that we would like to go into depending on what specialty in critical care medicine we want to go into. I really like the fact that, for example, the hospital, the program, or the residency that I'm applying to, they like to get back to their community. This is something I wish to pursue as a physician assistant. If you want to do research, for example, I really like the fact that's a big one. So always research is huge. So definitely, if you're interested in research, definitely make sure you let them know during your interview. I had done research as an undergraduate, so I discussed my research, which was something that really impressed them because it was very unique. And I also informed them that I want to pursue research, which I really do, of course, once I finish the residency. So if you are interested in research, definitely show your interest and also tell them what specifically do you want to specialize in. If you just say research, well, what specifically do you want to research? Is it, for example, status epilepticus, etc.? So make sure that you also specify what you want to go into research. Another question I got that really threw me off, and I got 2 questions on this, was in regards to scenarios. So I got 2 scenarios with 2 patients, and they wanted to know how you would work these patients up. So with these patients, with these scenarios, make sure that you know your ABCs. So airway, right? Breathing, circulation, B's, disability, etc. Make sure that you go through all your ABCs. So they'll give you a critical care scenario of a patient, and you have to work them up, and then you have to make sure that you give a good differential diagnosis, and then also explain your reason why you had this differential diagnosis, a treatment plan, and then explain your reason why you decided to give that treatment plan, etc. Always explain your reasoning. If anything, act like you're talking out loud during the interview. So for example, if it's a patient that's coming in with acute respiratory distress syndrome, and they're giving you the scenario that the patient has acute respiratory distress syndrome, they'll ask you what diagnostic test you want to do. I would say, I'm just speaking out loud, I would like to order a chest x-ray. I'd also like to order a COVID-19 swab on this patient, being that this patient is, say it's an 89-year-old female. She's 89. I'm not sure if she lives in a nursing home or in an area that's congregated where COVID-19 can be, there's several individuals that have COVID-19. So I'd like to get a COVID-19 to rule out that this is due to COVID-19, etc. So make sure that you're always speaking out loud of why you're doing certain diagnostic tests and why you're treating this patient a certain way, and what's your differential diagnosis. This is going to be very helpful. I have to say that I did not prepare myself for these questions. I did not know I was going to get them asked. So I started reading the ICU book before my 3rd interview. And on my 3rd interview, I ended up not having any of these questions. But now that I'm telling you this, make sure that you prepare yourself. I really recommend the ICU book just in general for understanding a little bit about the ICU, and it can prepare you for these type of questions. I'll also add a list below the books that I recommend so you can prepare yourself for the interview. There's also another book, which I apologize, I don't remember the name, which I'm gonna list below. And it just has common questions to expect in any job interview. And I think these questions were very, very valid, and there were questions that I got that were very similar for my interview. So I read this book like back to front several times, and then the ICU book also. I didn't get through the entire ICU book, I just switched. Definitely be familiar with mechanical ventilation questions, also pneumonia questions, and then definitely any type of cardiac heart failure questions. Those were some of the questions that you might be expected to know and elaborate a little bit more. So that's how you can prepare yourself in regards to the interview. Definitely research, once again, the program that you're going to be applying to. Impress them with the knowledge that you have in regards to the program. Research the individuals also that you're going to be interviewing with. In addition to that, also ensure that you know why you decided to do critical care medicine, right, or emergency medicine, for example. Ensure also that you know yourself very well. If anything, I would ask your fellow friend or your husband or sister or family member, etc., to tell them how they can describe you, because you are definitely going to be asked a question to describe yourself. What are your weaknesses? What are your strengths? If you do have weaknesses, what are you doing to improve those weaknesses? Talk about your experiences in critical care medicine, right? Like we discussed, why critical care medicine? What have you done to do critical care medicine? Why residency or fellowship? Why did you decide to apply to one instead of going straight from PA school? What is it going to do for you? And then what is it going to do for them? Ensure that you tell them that you're going to stay with them, and ensure that you are telling them that you're going to provide the best patient care that you can for your patients. Familiarize yourself with the patient population. And then, of course, make sure that you have good questions to ask at the end. So some of the questions I asked were, for example, what do I expect in regards to the salary that I may receive? Do we have any stipend? Also, other questions I like to ask was just if they can tell me what is their patient population, what are the type of patients that they see. And one of the doctors that interviewed me was very impressed with this question. And I informed them, I just want to make sure I familiarize myself with the patients here, since I'm not from the area that I'm applying to. So make sure you have really good questions to ask also. You can ask also about parking, working in park, if you end up getting accepted into the residency or fellowship. One of the questions I asked was also, what are the scrub colors? And so like in my case, it's navy blue. So also make sure that you ask those questions. I would also ask, who are you going to be paired up with? Is it going to be with APPs or physicians, etc.? And then you can also ask, what is my schedule like? How many hours am I expected to work a week? And one of the questions that they were very impressed when I asked them was, what do they expect me to have accomplished at the first month of the residency, at the second month of the residency, at the 6 months of the residency, and at the end of the residency? And the reason I asked this is what I told them, is so that I ensure that I'm ensuring that I'm up to par with what the expectations they have of me. And then I also asked if once I complete this residency, will I be offered a job, or will there be any job positions for me to apply to? That's definitely a very, very important question to ask. So that's another question I would ask also. So I hope this video was helpful. If you have any questions, please comment below. I will reply as quick as I can. Being with this residency, as I discussed my schedule, it's very busy, so sometimes I don't have time to respond, but I will respond as quick as I can. Also, if there's any topics you want me to discuss in future videos, please comment below so I can address them in videos. I know I may have not addressed all the questions that I got and I've been asked, but just for the sake of time and so that I don't make this video extremely long, I just kind of wanted to hit the high points. So hopefully this video was helpful for you guys. I really recommend a residency, whether you're a nurse practitioner or physician assistant. It's amazing. You are armed with all this knowledge that is going to prepare you as a better physician assistant. You'll be very comfortable with making quick decisions, especially with patients that are crashing very quickly, and then also with procedures. All right, guys, have a good day, and I'll talk to you guys later.